serious are the threats to the NIH, NEA, National Endowment of the Arts, and National Institute of Health, and so forth? Are the proposed cuts just a bargaining ploy or distraction, or are they real? Too early, where are you, Steve? Too early to tell. There have been lots of presidents that have produced lots of budgets that have been ignored by Congress. This one was particularly draconian because, I mean, there's two things about it that were interesting to me. One, President Trump said, oh, this is going to be a big buildup of the military. Well, I've been on the Armed Services Committee for 10 years. I'm very familiar with what our funding has been for the military. President Trump's budget asked for a 3% increase over the last Obama budget for the military. So I'm not thinking that a 3% increase is what most Americans think he proposed. I think he's tried to characterize it as, I'm really going to take care of the military, and he really is basically asking for about the same amount Obama did in his last budget. But what they did for that $54 billion, that represents the 3%, is they cut to the bone discretionary domestic spending, with very few exceptions. And I would tell you that here in this community, I have a list of all the things that would not have happened if these cuts go through. The U.S. Department of Agriculture, everything from grants to a car wash here in Fulton to a playhouse, HVAC and a playhouse theater, to helping somebody start a business and marketing honey ice cream from their honeybee farm, to a grant for processing and marketing of processed pork from their farm. William Woods got equipment and supplies for a new pre-veterinary medicine program. Holt Summit got a loan for a regional pump station and existing wastewater treatment facility. So those are the kinds of things that are funded through the agricultural department in terms of economic development and supporting communities, and those are will all be gone if the president's budget goes through. Essentially, people need to remember that in Jefferson City, almost 33 cents out of every dollar that's spent is your federal tax dollars. We send it down from Washington and they decide, you all decide how it's spent. The city of Fulton, whether it's through USDA or whether it's through community development block grants, make applications, or Tiger grants, make applications for highway projects. And those are all your federal dollars that come home. And so 25% of the discretionary domestic spending in Washington is in fact money that comes to the states. It's not bureaucrats sitting around in Washington messing with people through aggressive regulations. It's actually just money that comes down to you all to do what you think is best. And so that's why I'm not sure if this budget will actually get through. And for research, I don't need to tell anybody that what research dollars means in Missouri, whether it's FACRI at the university or whether it is research dollars that are part of animal health, or whether it's part of the University of Missouri or Washington U or Stowers. Hundreds of millions of dollars of medical research and scientific research dollars are coming to our state, really good jobs, lots of economic drivers. And so I think there'll be a lot of Democrats and Republicans that will push back on the president's budget. So we'll see. When they've only given us the skinny budget, and they'll give us all the details in May, and we'll know a lot more then. I'm not going to do all four of them because it would take too long, because they all require a lot of answers. Free college tuition is a great goal, except it's really expensive. It's really expensive. And we are struggling with how we're going to pay for what we have in place right now in terms of Medicare. We have a demographic bubble that is moving into the system, and we have interest rates going up, and we owe a lot of debt. And if we're not careful, we're going to get so far under that we could be Greece. So while I'm a very big supporter of Medicare and a very big supporter of, for example, expanding Medicaid in Missouri, it's a name that has not been expanded in Missouri, I also want to be mindful of the fact that we can't just start having the government pay for everything. That when people talk about that and they point out countries where that happens, the people are paying 70% of their income in taxes in those countries.